Hello everybody, in this video I'm going to talk about Captopril. Captopril is the second example of angiotensin converting enzyme inhibitors. Captopril background and indication. Captopril is a small molecule. Its chemical structure composed of 9 carbon atoms, 15 hydrogen atoms, 3 oxygen atoms and 1 sulfur atom. We can observe its structure in the right. It's an ACE inhibitor, which is used for the management of essential or renovascular hypertension, congestive heart failure, left ventricular dysfunction following myocardial infarction, and nephropathy. Captopril is a potent competitive inhibitor of angiotensin converting enzyme, or ACE, the enzyme responsible for the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 regulates blood pressure and is a key component of the renin-angiotensin-aldosterone system, or RAAS. We can use captopril for the treatment of essential or renovascular hypertension, usually administered with other drugs, particularly thiazide diuretics. May be used also to treat congestive heart failure in combination with other drugs such as cardiac glycosides, diuretics, beta-adrenergic blockers. Captopril may improve survival in patients with left ventricular dysfunction following myocardial infarction. May be used also to treat nephropathy, including diabetic nephropathy. About the doses of this drug, the available doses are 12.5, 25, 50, and 100 milligrams. The maximum daily dose is 450 milligrams per day. Caputen is the most common brand name of captopril. It is available in 25 and 50 milligrams. We also have Captoplus, which is a combination between captopril and hydrochlorothiazide as a diuretic. The first number represents captopril and the second is for HCT. We have these 4 doses, 25 over 15, 25 over 25, 50 over 15, and 50 over 25 milligrams. About its mechanism of action, captopril antagonizes the effect of the RAAS. The RAAS is a hemostatic mechanism for regulating hemodynamics, water, and electrolyte balance. During sympathetic stimulation, or when renal blood pressure or blood flow is reduced, renin is released from the granular cells of the juxtaglomerular apparatus in the kidneys. In the bloodstream, renin cleaves circulating angiotensinogen to angiotensin 1, which is subsequently cleaved to angiotensin 2 by ACE. Angiotensin 2 increases blood pressure using a number of mechanisms. First, it stimulates the secretion of aldosterone from the adrenal cortex. Aldosterone travels to the distal convoluted tubule DCT and collecting tubule of nephrons, where it increases sodium and water reabsorption by increasing the number of sodium channels and sodium-potassium ATPases on cell membranes. Secondly, angiotensin 2 stimulates the secretion of vasopressin, which is also known as antidiuretic hormone, or ADH, from the posterior pituitary gland. ADH stimulates further water reabsorption from the kidneys via insertion of aquaporin 2 channels on the apical surface of cells of the DCT and collecting tubules. Thirdly, angiotensin 2 increases blood pressure through direct arterial vasoconstriction. Stimulation of the type 1 angiotensin 2 receptor on vascular smooth muscle cells leads to a cascade of events resulting in myocyte contraction and vasoconstriction. In addition to these major effects, angiotensin 2 induces the thirst response via stimulation of hypothalamic neurons. ACE inhibitors inhibit the rapid conversion of angiotensin 1 to angiotensin 2 and antagonize RAAS-induced increases in the blood pressure. ACE, also known as kinase 2, is also involved in the enzymatic deactivation of bradykinin, a vasodilator. Inhibiting the deactivation of bradykinin increases bradykinin levels and may sustain its effects by causing increased vasodilation and decreased blood pressure. Absorption of captopril is about 60 to 75% in fasting individuals. Food decreases absorption by 25 to 40%. Some evidence indicates that this is not clinically significant. In one study, the average volume of distribution, or VD, was 0.2 liters per kilogram for the central compartment and 2 liters per kilogram for the elimination or beta phase. The VD at steady state was 0.7 liters per kilogram. Captopril actually 25 to 30% bound to plasma proteins, primarily albumin. About the metabolism of captopril, the major metabolites are captopril cysteine disulfide and the disulfide dimer of captopril. Metabolites may undergo reversible interconversion. About the route of elimination of captopril, actually 40 to 50% of this drug is eliminated in the urine as unchanged, uh, with of course disulfide and other metabolites. The elimination half time has been reported to be 2 to 3 hours, but this is increased in renal impairment, 2.5 times for captopril and 4 times for the disulfide metabolite. Captopril has a relatively brief elimination half-life, which is less than 2 hours. Clearance is by metabolism in the liver, captopril cysteine disulfide and the disulfide dimer, and excretion by the kidney. Okay, what's about toxicity, adverse and side effects of this drug? Actually, symptoms of overdose include emesis and decreased blood pressure. Side effects include dose-dependent rash, usually maculopapular, taste alterations, hypotension, gastric irritation, cough, and angioedema. Now I have some warnings, precautions, and tips for patients who actually want to take this drug. We have first of all food interactions. Avoid hypertensive herbs such as bayberry, glucohosh, cayenne, ephedra, and licorice. Avoid also potassium-containing products because they increase the risk of hyperkalemia. Limit salt intake because salt may attenuate the antihypertensive effect. Take separate from meals. The presence of food decreases absorption of this drug, so you should take this drug 1 hour prior to meals. Do not use captopril if you are pregnant. Stop using captopril and tell your doctor right away if you become pregnant. If you have diabetes, don't use captopril together with any medication that contains aliskiren. Tell your doctor about all your other medicines. Some drugs should not be used with captopril. What should I do before taking this medicine? First of all, you should not use this medicine if you are allergic to captopril or to any other ACE inhibitor. Secondly, don't take captopril within 36 hours before or after taking medicine that contains sacubitril, such as Entresto. To make sure captopril is safe for you, tell your doctor if you have ever had stomach pain, low blood pressure, low white blood cell counts, connective tissue disease such as Marfan syndrome, Sjogren's syndrome, lupus, scleroderma, or rheumatoid arthritis. And here we have some images that represent the morphological symptoms of lupus, scleroderma, and rheumatoid arthritis. Moreover, if you want to take this drug safely without any problems, you should tell your doctor if you are on a low salt diet or if you took or are taking medicines that weaken the immune system, such as cancer medicine, steroids, and medicines to prevent organ transplant rejection. If you are a diabetic patient and suffering from diabetes, liver or kidney diseases, or if you are on dialysis, in all these situations, you should also tell your doctor that you have these disorders before taking this drug to ensure taking it safely. The most common question here is how should I take captopril? Actually, take captopril exactly as prescribed by your doctor. Follow all directions on your prescription label and read all medication guides or instruction sheets. Your doctor may occasionally change your dose. As I said before, take on an empty stomach at least 1 hour before a meal. Call your doctor if you have ongoing vomiting or diarrhea, or if you are sweating more than usual. You can easily become dehydrated while taking captopril. So this can lead to very low blood pressure and electrolyte imbalance or kidney failure. Your blood pressure will need to be checked often and you may need frequent blood tests. If you have high blood pressure, keep using this medicine even if you feel well. High blood pressure often has no symptoms. Captopril may cause false results on a urine test. Tell the laboratory staff that you use Captopril. Tell your doctor if you have a planned surgery. Store tightly closed at room temperature away from moisture and heat. We have some dosing information. For usual adult dose for hypertension, the initial dose is 25 milligrams orally 2 to 3 times a day, 1 hour before meals. The maintenance dose may increase every 1 to 2 weeks up to 50 mg orally 3 times a day. If blood pressure remains uncontrolled after 1 to 2 weeks at this dose, add a thiazide diuretic, loop diuretic if severe renal impairment exists, and titrate to its highest usual antihypertensive dose before further increases of captopril. Most patients experience satisfactory clinical improvement at 50 or 100 mg orally 3 times a day. Should generally be used in conjunction with a diuretic and digitalis. Usual adult dose for left ventricular dysfunction. The initial dose here in this situation is 6.25 mg orally once as early as 3 days post myocardial infarction, followed by 12.5 mg orally 3 times a day, increased to 25 mg orally 3 times a day over the next several days, and then increased to target dose over the next several weeks as tolerated. To improve survival following myocardial infarction in clinically stable patients with left ventricular dysfunction manifested as an ejection fraction of 40% or less, and to reduce the incidence of over heart failure and subsequent hospitalizations for congestive heart failure in these patients. Usual adult dose for diabetic nephropathy, 25 mg orally 3 times a day. We have here some comments. Other antihypertensives may be used in conjunction with this drug if additional blood pressure reduction is required. Usual adult dose for hypertensive emergency, 25 mg orally 2 to 3 times a day, continue diuretic therapy and stop other antihypertensive after initiation of this drug. May increase dose every 24 hours or less until satisfactory blood pressure or maximum dose is reached. Here is a very important question, by the way. What happens if I miss a dose? Take the medicine as soon as you can, but skip the missed dose if it's almost time for your next dose. Don't take 2 doses at one time. What happens if I overdose? Here in this situation, of course, you should seek emergency medical attention. What should I avoid while taking Captopril? Avoid getting up too fast from a sitting or lying position, or you may feel dizzy. Do not take potassium supplements or use salt substitutes unless your doctor has told you to. Avoid becoming overheated or dehydrated during exercise in hot weather or by not drinking enough fluids. Follow your doctor's instructions about the type and amount of liquids you should drink. In some cases, drinking too much liquid can be as unsafe as not drinking enough. Avoid strenuous exercise if you are being treated for heart failure. Ask your doctor about your risk. What other drugs will affect Captopril? Captopril can harm your kidneys, especially if you are also use certain medicines for infections, cancer, or osteoporosis. Tell your doctor about all your other medicines, especially diuretic or water pill, that may increase blood potassium, such as spironolactone, trimethoprim, and amiloride. Non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, naproxen, celecoxib, diclofenac, indomethacin, meloxicam, and others can also interfere with captopril. Medicine to prevent organ transplant rejection such as temsirolimus, sirolimus, or everolimus, or heart or blood pressure medication can also interfere with this drug. Thank you all for watching. My next video is going to be about enalapril. Please like and subscribe for more videos.